I've been having incredible problems with my memory, which really terrify me. I'm forgetting lunch dates, I'm forgetting appointments. I forget things all the time, all the time. And I'm really scared. Everybody hears stories about Alzheimer's, and I was terrified that since my memory was clearly impaired, or I feel like it's clearly impaired, that it's Alzheimer's.
How old are you?
53.
53. And how long have these symptoms been going on for?
For a long time, like a couple of years.
A couple of years. And have they been getting worse? They've been stayed the same?
You know, I can't really tell if they've gotten worse, but it just feels like everybody now is noticing it because I'm forgetting dates all the time.
It's actually a very frightening experience where, exactly as Audrey described, where she's terrified that she has something like Alzheimer's disease. She's afraid to seek help because she's worried that when she does seek help, she's going to be told that she has Alzheimer's. And that prevents her from actually from taking care of the problem.
So tell me a little bit about your medical history. What's been going on in terms of, have you had any surgeries recently?
Yeah, I've had a lot. I started out with acute interstitial nephritis, and then I went on to develop all kinds of intestinal problems and have had several intestinal resections.
Oh, so you've had a lot of resections of your bowel.
Yes. Major resections, actually.
Okay, and you've been in menopause now. You've not had your period for some time now, is that right?
Yeah.
Okay.
I came to taking care of patients with memory problems because I trained at Columbia with the Memory Disorders Clinic. And one of my first patients there was a woman who was in her 50s that we initially diagnosed with Alzheimer's, who turned out to have problems related to low estrogen. So that led me down a road of looking at the changes that happen to women as they go through menopause and as they stop having their period, what happens to their brain.
What about hot flashes at night? Are you
I
getting...
have hot flashes all the time. I can't sleep at all. I really don't know what's going on. I feel like my whole life is sort of topsy-turvy. I don't remember things. I'm not sleeping, and I don't know what's related to what. I've had so many medical things that it's really hard to sort it all out.
Okay. And now you've had MRIs of your brain, is that right?
Yes.
In the past? Okay. And they've all been relatively normal from what you're saying?
Yes.
Okay. All right. Is there anything else that you wanted to tell me that might be important that maybe I haven't asked
Take
you?
a lot of medication.
Yeah.
You know, I don't know if that could possibly have an effect on anything, but I'm very, very nervous about Alzheimer's. Premature onset Alzheimer's.
Early onset. So you're worried you might be developing Alzheimer's or another type of dementia.
Yes.
Does
Does
anyone
it
here
sound like it?
We're going to find out.
Okay.
You know, does anyone else in your family have?
No.
No one else has?
No.
Your parents, your grandparents? There's no history of dementia in your
No.
family? Okay. Have you ever had any kind of head injury where you passed out for a period of time without?
No.
Okay, so there are no risk factors really for dementia at this point, aside from your symptoms,
Yeah.
where you're having a lot of trouble forgetting and it's getting worse.
Right.
Yeah. Okay.
We did a study looking at this, and we found that the incidence of memory changes related to menopause is as common as the incidence of hot flashes or night sweats. So very common. About 60 to 70% of women experience this as they go through perimenopause into menopause in their mid-40s to their mid-50s.
Okay, so this is what I think is going on. My feeling is that probably as a result of all the surgery you've had, and you were going through menopause when your period stopped, and you were put on hormones to help with the menopause, I think that because of the surgeries, the bowel surgeries, estrogen is not being well absorbed. And that's why you've now started to get the hot flashes and started to have memory problems. What I'd like to do is I'd like to do two things. I'd like to have you get an evaluation of your brain, of your memory and your thinking, just to make sure that we have a good baseline, and also to see whether there really are any problems objectively. And then the second thing I'm going to do is to have you go to get an MRI of your brain. And then once those tests are done, then you'll come back in and I'll see you at that time. Okay?
Okay. Dr. Debbie did tests and did tests of my cognitive abilities and did blood work to see what my hormone levels were, and she sort of did detective work to find out why my memory was impaired. And my memory certainly showed up as being impaired in the testing that she did.
So, so this is what we found on your testing. We found that if 10 is average, so you see this little line in the middle is a 10, then anything that's below is below average, and anything that's above is above average. So what we found with you is that in many areas, your overall ability is at about the 90th percentile, so you're obviously a very smart person compared to other people in your age group, but that in some areas that have to do with memory, you're falling to well below average. And that may be why you're having difficulty with performing. And the same thing even with your memory scores, that you were having a lot of problems with remembering things. So the good news is that this pattern doesn't really fit with a pattern of dementia at all. And this looks very much like something related to estrogen-related memory loss. So I think because you were estrogen deficient, that's why you were having some of these difficulties. And what we're going to try to do now, you can see how you've been struggling, and that may be why you thought you had Alzheimer's disease, is we're going to put you on a patch. And if we put you on an estrogen patch, then that's going to bypass your bowels, and it's going to get absorbed through your skin, and then we'll see how you do.
Oh, that'd be great.
All right? So I'd like you to keep track of how often you have night sweats and how you do with your overall cognitive functioning over the next few weeks, and I'll see you back in 6 weeks.
Okay, great.
Okay.
Thank you.
All right.
It was a huge relief. I was really terrified that I had Alzheimer's. Really terrified. So it was like the best news I could have gotten.